With that, I would like to introduce Dr. David Stewart. He is the Director of Clinical Training at the Seattle Pacific University Clinical Psychology Program and has been a longtime partner with us in the Public Behavioral Health Division in Psychiatry. He's an expert in substance abuse, co-occurring disorders, working with juvenile offenders, conduct disorder problems, as well as issues of cultural and other forms of diversity. And I've collaborated on projects in this area for a long time. And I'm very glad to have him come speak to us today about referring folks from diverse backgrounds to evidence-based practices.
Thank you. Thank you. Good afternoon, everybody. Let me pull up my show. And what I'd like to talk about today, and maybe my head's a little light, so I'm going to take a risk and turn off the lights and hope you'll stay awake. What I'd like to talk about is using evidence-based interventions with culturally diverse children and families, and really talking about strategies for engaging families. One of the things I think is a challenge for referring children and families from diverse backgrounds to evidence-based practices is the question in the mind of providers and those providing the referrals as to whether the evidence-based practice is applicable, adaptable, or appropriate for a particular group or individual. And I think that question is a fair question to ask with evidence-based practices. We'll talk a little bit about why that is. But then I'm also going to talk about ways, what I call some adapter plugs that can help us bridge some of the gaps that we might find in evidence-based practices. And I'll talk some about the evidence for use of these practices in diverse populations. And so we give a little bit of rationale for attending to diversity in evidence-based practice implementation and referral, though I realize you're a self-selected group who comes here, so you probably don't need a lot of rationale for doing so. I'll talk about some of the methods for maintaining adherence and fidelity and engagement. So the challenge in referring children of color, for example, to evidence-based practices is that we're worried that in adherence to the evidence-based practice, we're going to lose the ability to engage families. And that's really what I want to spend some time on. And so we'll talk about some of those methods that might be done and what we might expect to be effective in programs that are implementing these practices. And then I'll give a little bit of programmatic and case examples if time permits. We're going to skip something probably. In terms of rationale, the real wake-up call, one of the real wake-up calls around this was the Surgeon General's report at the beginning of the decade that looked at the rate of ethnic representation in randomized randomized clinical trials for major areas of psychopathology. And what you see in this graph is that for Hispanic or Latino groups, Asian Pacific Islander groups, and American Indian and Alaska Native groups, there's very little representation in the clinical trials that form the basis of not only our evidence-based psychotherapy practices, but our evidence-based psychopharmacology practices, that these groups are incredibly underrepresented. The red bar represents the proportion represented in trials that paid attention to ethnicity at all, and so you can see in those trials you had some representation of African American populations, a little more representation of Hispanic or Latino population. And then the majority of trials simply did not attend to ethnicity as a variable, partly because of the low representation of these groups in the trials. It simply probably didn't rise to the statistical power to be appropriate for analysis. Another reason to attend to evidence-based practices is many of the conditions and circumstances that are facing children and families have a disproportionate impact on communities of color.